I tend to see a lot of patients with vaginal problems, vaginal infections, recurrent yeast infections, even away from the typical OB or GYN patients with abnormal bleeding, sexual dysfunction, a lot of hormone replacement therapy treatments. So a huge variety of women. Another big population of mine are patients with polycystic ovarian syndrome. It's a constellation of a little too much testosterone, so you can get some hirsutism on your face, your chest. You have irregular periods, so they can be spaced out quite a bit, trouble getting pregnant. They end up having more diabetes and heart disease later on. So I like to find those patients and get them on the right track, treating them earlier than later. In the Department of OB/GYN, their foresight into creating an Olson Center that incorporated all of female care, primary care, OB/GYN, breast disease, psychiatry, I just think that's great. And me as a patient, I think a one-stop shop, I'm too busy to go to multiple different places. And if I can get it all done at one time, oh, that's wonderful. And the more time I practice, the more I want to teach. I think gaining confidence and feeling comfortable in what you're doing, then you get to a point where you want to provide a good teaching environment for others and hopefully instill some of your knowledge on them. It's amazing to give, to teach, to give back. Basically, they'll get a full physical, and we'll do the pap smear, make sure there aren't any issues we can help them with. But we cover contraception, make sure they're not having any incontinence that's bothering them, breast exam. I mean, they just get a full history and physical. If there are other physicians that we need help, involvement with, we can provide that very quickly and with good direct conversation with that physician because they're in the office right next to us. The connection that I need to make is I need to see what kind of person it is that's coming in to see me. So I like to ask what they do for their hobbies. Do they get much exercise? What's their job? You know, if they're married. So get a sense of who they are and what their daily life is like. And then I can figure out risk factors for them as far as obesity or they're not exercising enough. So the relationships come. That just comes. But for me as a physician, I need to know what the patient's doing on the other side. What are they doing when they leave the office? How are they living their life? Are they living a healthy lifestyle or not? So I think that's the most important at the beginning. And then as you see them back every year or every 3 months, the relationship just grows. And you talk about kids and you talk about family. I think it's important for them to be comfortable with their physician so that they can come to you with any problems. You know, we deal with very private issues, and if they're not comfortable talking about it, you're not going to give them complete care. So it's important. We do the best we can, and we hope it helps. I'm Dr. Sylvia Ziegenbein. I'm an OB/GYN, which is obstetrician gynecologist. I did my residency here at Nebraska Medical Center, and my medical school was here also. So I have a MD. I also have a master's in molecular biology that I got before I went to medical school.